Doctors of Reddit, what was your dumbest I am Verismart patient experience? RM here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds. Diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes and he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams no. No water. He's allergic to water. Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. You can't make this crap up. I work in the air. We had a very pregnant patient come in needing stitches in her lady parts. Turns out she was a realtor and didn't want her water to break while she was showing a house. So she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house and sure enough, it broke and cut her up pretty bad. Between the guy putting arm blood into his dong and now this, I don't think I'm gonna see my genitals again for a couple of days. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake and she said she drinks a 32-ounce soda every day. I ask her if it's regular or diet and she replies with it's half regular. I let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. I have had several arguments with diabetics about Coke, Kool-Aid, sweet tea versus those made with artificial sugar. I tell them, look, don't drink sugar. If you have to have something like that, use an artificial sweetener. No way. That stuff is poison. It will kill me, mom. Your A1C is 14. Sugar is already killing you. I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child, in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was Savine powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. Had a neighbor in rural TN who was convinced that the best way to treat her child's head lice was to comb diesel fuel through it, and that doing it in an enclosed living room while smoking cigarettes was acceptable. She was baffled when CPS took her kid away. 70-year-old female tripped and fell 2 days ago. She came in with hip pain but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative no, you are wrong. Just stop it. This has got to be the medical equivalent to the update you installed on the computer a year ago is making it run funny. Get over here and fix it. I work for an optometrist and it was the month before school started and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 feet in front of him, and will definitely need glasses for school. For some reason this caused a switch to flip in the moment she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out and that doctors are all a con artist trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them but that she was free to get a second opinion and gave her a copy of the kid's prescription and sent them on their way. About 4 months later the lady is back asking for another copy of her son's prescription. Apparently the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needs glasses. Most of my own stories go along similar lines to patient has chest pain driving a coach load of school children. Thinks it's indigestion. Swigs bottle of Gaviscon. Later diagnosed with a huge heart attack. My favorite ever story from a colleague. A patient comes into A&E with abdominal pain. As part of the workup he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's column, the statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson. He lives up there." I've got 2 stories that stick out in my mind. The first is the mother of a toddler who came into emerg. The kid had cruddy green bloody stuff coming out of his left nostril, and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mum was sure he caught a sinus infection and just wanted some antibiotics. Now I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely given the one-sided nature of his condition. But Mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until I pulled out a big Olay button battery. It would have been burning his nose for a couple days. Hopefully he healed up well. Side note, if a kid swallows a button battery, it can do a similar thing to their esophagus. This is an emergency and needs to be dealt with ASAP. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a D&C so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with higher levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the doc saying, "We don't know why you have these constant higher levels of HCG in your blood and we are worried." Clinical pharmacist here, BTW, with one story in the ear and one in the pharmacy. A physician told me this one. 16-year-old boy presented to the ear with an extremely swollen discolored dong. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own dong. He thought that adding blood would help increase his size. His dong was terribly infected and he was hospitalized for a week or so. 2. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each and was adamant that was how they needed to prevent pregnancy. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own dong. His dong was terribly infected and he was hospitalized for a week or so. Frick, that is just gruesome. 80+ YO. Patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all, BTW. At some point you kind of have to stop being polite and just tell patients' family members bluntly that you don't have time for this crap and what you recommend, and they can do what they want and just document everything. It happens a lot, but she sticks out. Not my story, rather my colleague's. A patient was admitted for anemia and a localized cancer was found. She was referred to surgery so she can get cured from her localized cancer, and she started telling everyone that it was the doctors who caused the cancer and that she was doing just fine before coming to the hospital. She lectured the surgeon and my colleague, who pleaded her to get her surgery so that the cancer doesn't advance, and yet she refused, saying she knew better and probably didn't even have cancer. Some people. This kind of reminds me of my brother. He told me that when he was younger, 5 or 6 years old, he thought that when a doctor diagnosed you with a disease, it means that they actually gave you that disease. The only difference is, he quickly realized this wasn't the case and didn't become a freaking idiot like this lady. Not a doctor, I'm an optician, and at this point I was a young lady in my mid-20s. I had a guy come and saying he was a doctor and he wrote himself an RX for glasses and he brought frames. A few days later his lenses come back. He puts on his glasses and he can't see. I start going through the possibilities. Usually with progressive lenses it's an adjustment issue and they need to sit differently on his face. He completely refuses to let me adjust them. So I check the lenses and the RX match what he wrote. I try to explain that there's only 2 options. Either they need to sit differently on his face or the RX isn't good. He tells me, "You don't understand. I've had eye surgery for a disease that you've never even heard of." I offer to remake his lenses to prove a point. His new lenses come in a few days later. An older co-worker is helping him. I told her everything. Again, he can't see. She tells him, "The young girl who tried to help you last time was trying to explain that if we adjust your glasses you might be able to see out of them. Will you please let me try?" He lets her and suddenly he can see. Granted, not perfectly because he wrote his own RX and the bottom sentence will explain more. Turns out fuckwit was a lung doctor and not even an eye doctor. 1. Picture a middle-aged man. His index finger is 5x the size of the rest of his fingers. It smells. It's leaking pus. There's necrotic tissue. Basically one huge infected cancerous finger. He was a firm believer in not taking any sort of medication, including antibiotics or chemo. Died a few weeks later, but he did manage to tell us we were all idiots before he passed away. 2. Patient was a young child who came in with an extremely high blood glucose level. Once she was stable we did some teaching and kept her for a few days for observation. For some reason every time I checked her, her levels would be extremely high although we were appropriately treating her. Turns out her family would bring her fast food for every meal and hide it in the side table. More teaching and resources were put into place. 3. Had a mom in hysterics because she was convinced that her neighbors, friends, stepsons, teacher's dog has MRSA so her baby was going to die. It took everything within me to not tell her that most of the hospital staff have MRSA, but it took 3 hours for me to finally calm her down after I called infectious control, her pediatrician, gynecologist, and family doctor. Yes, I had to call all these people. Yes, they laughed at me. Yes, she was beside me the whole time questioning their judgment. I love my job, but at times it makes me crazy. Just had some amazing people inform me with several scholarly documents that MRSA isn't as prevalent as once thought. It's only about 5% in hospital staff. Thank you wonderful people. LOL. When I read his index finger is 5x the size of the rest of his fingers, I legit thought it was 5 times longer than the rest of his fingers. I was like, I wonder what disease causes that. Derp. Whoa. I guess stupidity is relatable. Nurse here. The number of American 20-something males who don't know what circumcision is ridiculously high. They think that boys are born circumcised. Evidence. New fathers and mothers asking me what's wrong with their newborn son's dong. He still has his foreskin. Many parents choose to have it removed when the baby is a couple days old. It's called circumcision. Often followed by a parent's question, "What's circumcision?" That's when I face palm. Dead serious. We talked about circumcision in my grade 6 health class, but saw any pictures. I had absolutely no idea until I was in high school. I knew what it was but had nothing to compare it to. This was pre-Google. Not a doctor but a gastro nurse. We had a recurring patient who was just a really very strange lady. She had a stoma that absolutely stunk to high heavens because the last 20 years she has not been cleaning it properly. Every single day her stoma would come off because she was twisting the drain tube and wouldn't allow us to change it. So this lady was really rude and would shout at us too. And one night shift I couldn't take it anymore and I snapped at her. I didn't yell, but I was overly stern about the fact that if she did not let me clean and treat her stoma, then the MRSA that she wasn't able to get rid of because she refused Hibis scrub washes would eat her alive. In hindsight I didn't handle that very well, but she let me change the stoma. So this entire ordeal she's yelling at me that her stoma bags are not cut to fit her stoma, that they are too small because her stoma is 50 cm by 50 cm, to which I corrected her, saying that's impossible. She was adamant that's how big her stoma was. It was a 30mm diameter. When I was cleaning the stoma, she yelled at me because it was hurting, so she wanted to just pop the new one on. I explained it was hurting because of infection as she never cleans it. She proceeds to tell me that she knows better because she has had the stoma for nearly as long as I've been alive. I eventually ended up telling her to shut up and let me do my job, which seemed to work, and the stoma did not come off again that shift. When she was eventually discharged, she refused every placement to the point where we almost considered a court order to evict her. One of our F1s nearly cried with relief. My aunt, who has varicose veins, pretty obvious to anyone who sees it, once asked me why her legs hurt and what those bluish lines under her skin were. I almost went on to explain to her about dilated veins when she interrupts and decides for herself that those are her nerves, dying nerves, and the blue stuff was blood clots inside the nerves. I'm a med student. I was doing a respiratory system examination on this guy who frequently, about once a month, gets admitted in the general ward with complaints of breathlessness. He's had COPD for a couple of years. Quite bad. And he tells me that he isn't going to quit smoking because God told him not to. When asked why, he tells me that the people who are relying on him for their daily livelihood won't survive if he stopped. I went on to ask him if he meant the people at the cigarette factory or the health industry. He didn't get the sarcasm though. Patient comes to the surgery clinic with complaints of mass rectum. Now I wasn't there the first time he came, but the surgeon wanted to do a couple of investigations and advised him to get admitted. The guy decided he doesn't want to. Couple of months later, he comes back to the clinic. Apparently he went to one of these alternative medicine places or whatever, and they had tied this metal wire, not exactly sure why, around the mass. By then, this mass has eroded through it and was bleeding and had gotten much bigger. Turned out to be a cancerous growth. I was a unit secretary and nurse aide on a radiation oncology unit in the early 2000s. We had a patient show up through the year and was admitted for emergency radiation treatment. She had a massive fungating mass in her mouth that had consumed half her head. When the rad-onc doc tried to examine her and open her mouth, her remaining teeth fell out into his hand. It had eaten through the bones of her face, invaded her eye socket, everything. Doc said it was the worst case of mouth cancer he'd seen. According to her husband, she had a small lesion on her hard palate, and upon receiving the diagnosis of an early stage squamous cell carcinoma, she decided to treat with essential oils and things like frankincense because chemo was poison. Her husband said he had tried to reason with her, but she was adamant about the natural treatment. She died in agony shortly after. You know, I usually adamantly refuse to allow my happiness to be disrupted by stuff on the internet. But it's stuff like this that makes me feel justified in allowing myself to be triggered when I see someone I know on Facebook posting horrible misinformation from somewhere like Natural News. Not a doctor, but I'm a medical technologist. There are plenty of I am very smart moments, but this one was recent. Did a finger stick for a patient, ensured the little cut stopped bleeding, and then put a band-aid on it. Told her to collect a urine sample for testing. Test came back strongly positive. 4+ reading for blood. She complained to the doctor that there is no way she has blood in her urine, and that the blood from her finger stick must have entered the urine, throwing off her reading. She said it was my fault that I did her blood test before her urine test, and I obviously made a mistake. She repeated the test later in the afternoon, still at 4+. Came back a week later, still at 4+. The look on her face when I told her, sorry, mom, your result is still positive, was priceless. Okay, but for real, please stop sneaking blood into people's urine for your sick big pharma money grabs. Not a doctor, but a patient whose mother was like this. The doctor had to speak to me on the side because of it. My grandmother has Crohn's disease. Very badly. It skipped my mother and her brother. When I was 15, over the course of 6 months, I went from being 5 feet 9 and 190 pounds to being 110. I was a skeleton, extremely anemic, and coughing up blood. My mother was convinced it was something else. I forced her to bring me to a doctor and she spouted off all these possibilities. She then talked about what she Yahoo'd, not even Googled, Yahoo, about genetics and such, and Crohn's can't skip generations. Well, the doc said just in case, we're gonna run some tests. Long story short, I have Crohn's in my throat and small intestine. So does my cousin. It just skipped a generation. To think your mother didn't even Google, that's where she went wrong. My dad is an emergency nurse. He experiences the same thing doctors in the ER do. Maybe more so because he is the one in the rooms more often. Anyway, here's a good story from him. I had a patient come in with several pages he printed off the internet. He kinda slammed them down and said, "This is what I have." He had bloating, nausea, vomiting, diarrhea, bloody stool, and fever among other things. He insisted he had schistosomiasis. He was being a real jerk about it, like we're wasting time since he already knew what he had. So, I asked when did he get back from Africa, and he said, "Africa? I've never been to Africa. What the heck would I be doing in Africa?" I proceeded to tell him that schistosomiasis is a parasitic disease one gets while swimming in the Nile River or other rivers in developing countries like in Southeast Asia. He got pissed off at me because he thought I was being a smart butt. He got seen and diagnosed with gastroenteritis, the stomach flu, the bloody stool. He had hemorrhoids. Not a doctor. We had a patient come into our hospital with anorexia requiring treatment, which, as usual, she didn't want. However, she appeared to be eating her prescribed meals. After a few days it becomes clear she's not putting on any weight, but the room is clean and she's supervised for her bathroom visits, so we know she's not flushing it away. Turns out her family are going through some tough times and her dad's down on his luck and out of money. So when he's coming to visit his anorexic daughter in hospital every day, he is eating the food prescribed to her because he can't afford to feed himself. Mealtime is unsupervised if there's a family member there. Dad was blocked from visiting when the daughter fessed up. That's all around sad. Not an MD. I'm an RN that works with oncology, cancer patients, some of which are on clinical trials. I got a patient and, before starting his chemotherapy, reviewed some of his lab work with him. I told him his glucose level was 73. Normal range is usually between 70-100. He got really upset at this point and asked him what's wrong. Your labs are within range, and he said I need it to be 0. I said, what? Why would you want your glucose to be 0? He said he's trying to meet requirements for a new clinical trial that requires his glucose to be 0. I told him, I don't know what clinical trial you're trying to get into, but if your blood glucose was 0, you'll be dead or dying. He was not convinced because I'm just a nurse, so I sent a message to his MD asking them to educate their patients better. I had a 350 pounds patient, late 30s, brought in by his sweet old mother because she was concerned about his recent sweats and shakes. Tell me about his high IQ of over 140. I just nodded and ordered a blood panel. When I got back in the room with the results, he was trying to tell me how he knows more than me about everything to do with medicine. I told him I was diagnosing him with new onset diabetes. He couldn't tell me anything about the pathophysiology of diabetes. Then I asked him which IQ test he took and how old he was when he took it. He said it was an online test a few years ago, like on Facebook. He didn't know what a Stanford Binet test was. Anytime someone refuses to vaccinate their kids, here's just a small sample of some of the reasons I've been given. 1. Causes autism. 2. Made from aborted babies. 3. Big pharmacy scam. 4. Unnatural. 5. My kid cried when you gave him his vaccines last time. 6. I never got these diseases as a kid, so my kid doesn't need the vaccine. Seriously, frick you people. I feel sorry for your kids. Also, don't forget I've done my research followed by a strong smell of smoke that emanates from them because cigarette smoke isn't dangerous to kids. I've seen that more times than I'd like to admit. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.